when you go pick up a bag of chips, right? What is it? What is the serving size for Cheetos? Is 8 Cheetos? Who eats 8 Cheetos?
Right.
I can't eat 8 Cheetos in a little bag. The serving size for a little bite-sized bag is a half a bag. So that's the basic of my education. I have to start there because I put you on a medication that causes you not to be hungry or not even think about food, and I didn't educate you on what to eat. We're going to have a problem. Your hair is going to fall out. Your skin is going to look different. You'll be skinny, but you're not going to look the way that you want to look.
Thank you so much, Chorus. Hi, everybody. It's Olivia F. Scott with Freedom at the Mat, and welcome to another edition of Well Chat. So, wanting to be thin is nothing new. Since the beginning of time, the projected body type has been slender. Now, that's not the body type that I have and not the only one that I think is beautiful, but in our world, most people want to be smaller. They want to be slender. So enter the world of GLP-1s, and now this entire craze is making me mad. Personally, I'm like, what's happening? What's going on with GLP-1? So I am turning to an illustrious, esteemed, and credentialed doctor, the one and only Dr. Courtney Arianne Washington, to talk to us today about what's happening with GLP-1s and get the real lowdown on the health benefits, on how they make our lives better, what side effects we have, and who they're really for. Dr. Courtney, how are you today?
I'm wonderful. How are you, Olivia?
Oh, I'm so happy to have this conversation. Thank you for making time in your very busy schedule here at Fleur de Lis Aesthetics and Apothecary to have it with us.
Of course. Thank you for having me.
Oh, I'm so happy. So can we talk about this?
Absolutely.
All right. So to start, given that we live in a social media world where people say they're doctors and they're not, I would like for you to just ground us in your credentialing and who you are and what you do.
I am a board-certified physician. I'm a doctor of osteopathic medicine. I am boarded in family medicine.
Okay. All right. And you have all the credentials.
Yes, ma'am.
Okay.
4 years of medical school, 4 years of undergrad, after medical school, 3 years of residency at Medical Fort Worth.
We appreciate you. And you also operate Fleur de Lis Aesthetics and Apothecary. Am I correct?
Yes, ma'am.
Okay. Right here in New Orleans.
Absolutely.
Will you share with us what you do at Fleur de Lis Aesthetics and Apothecary?
So at Fleur de Lis Aesthetics and Apothecary, I am a wellness and medical aesthetic clinic.
Okay.
So we focus on wellness, preventative health exams. We focus on IV hydration, medical weight loss, and all of the things when it comes to wellness and preventative medicine. What I wanted for this practice and for my patients is what I want. I want someone that knows me. I want someone that's not just going to do my labs and say, oh, you're okay. Go over my labs. It's so important for patients to understand their metrics so that if they move to another state or if they're in an accident, we know where we stand, and it'll help the clinicians help them better. So in this practice, we are focused on preventative health. We're focused on education and helping you live better and enjoy your retirement years. We don't work for all of our life only to retire, and our days will be filled with doctor's appointments.
Right.
There is a treatment for that. It is preventative health, and that's what we do here.
Ooh, thank you so much. So inspired by you, so grateful for you and your commitment to health and wellness, especially for people of color. We appreciate you. All right. So now will you please explain for us once and for all, in layman terms, what are GLP-1s? What do they do? Who are they for? I've heard so much about them, and as somebody who is a naturalista, I'm like, I'm just going to work out and drink my water. But even now, I'm beginning to think about, okay, should I do them? So what are they?
So GLP-1s are a class of medications that we call peptides. So they are actually kind of like a hormone, and it's similar to the GLP-1 that we actually make in our stomach naturally.
Okay. And what do they do in our bodies?
So they do so many things, and we're still discovering exactly what they do. But its main function is to basically regulate your glucose levels. So it slows gastric emptying, so you feel fuller longer. It also modulates how your body takes up the nutrients from your gut on your brain. So it really plays with the pleasure reward that we get when we have a piece of cheesecake or a cookie. And it also does other things with metabolism of your glucose in your liver. So many different functions that it's hard to just label it as one, which is what makes it revolutionary and what has made it basically change the market.
And so you're excited about this, right?
Absolutely.
Why are you, as a doctor, excited about this medical innovation?
I'm excited about it, number one, because we're talking about obesity in terms of it not being a lifestyle choice only. It's really a clinical medical diagnosis. It's not a one-size-fits-all sort of thing. And this medication actually gives people the opportunity to lose the weight without having an invasive surgical procedure because there are side effects that come with that. In addition, without the food noise clouding the decisions of whether I should have a salad or whether I should stop at McDonald's, it allows people to actually make healthier food choices and improve their quality of life.
How does it do that? Because if I'm on a GLP-1, I still want some McDonald's, a Happy Meal or something, right? Even if it's small.
That's the greatest point. Do you really want it? What it does, if you talk to people that have been on GLP-1s, what it does is it causes food apathy, where you're indifferent to it. It's like, I love this Big Mac, but do I really want it? When your brain doesn't give you the compulsion to say, oh, when I eat this French fry, oh, it's going to taste so good. And when you do taste it and it's like, it allows your brain to really decipher, did you really want it? Is it really nutritious? If you're hungry an hour after consuming this meal, you're not really giving your body the nutrients that it needs. And so these GLP-1s actually also allow you to hear your body naturally saying, hey, eat something salty because maybe my blood pressure is low, or maybe I need something sweet because my blood sugar is low.
Okay.
So it allows your brain and your body to make healthier choices.
So does the GLP-1 affect your body and your brain?
Absolutely. Absolutely. So the hunger signal, anytime that your blood sugar is low, you see how your stomach starts to rumble and you get that hunger sensation? That is controlled by signals that your brain is sending to, your body is sending to your brain to say, hey, I need to eat something. When you cut off that loop, that's another side effect of a GLP-1 because now I'm not hungry, so I should just not eat. That is absolutely not the right thing to do, and that is what is happening a lot. So we're starting to see the opposite, which is protein calorie malnutrition.
And what is that?
That is when you're not eating enough calories and definitely not eating enough protein to give your body the nutrients it needs to perform basic vital functions. The goal is to lose subcutaneous fat or fat that's surrounding your organs.
Right.
It's not just to lose protein from your muscle because if you don't have any more fat there, your body is going to default to breaking down fats, it's going to break down proteins, and that's not what we want. We don't want our muscle being used as fuel.
These drugs were developed for type 2 diabetes, as we all know, but people are now using them widely. What do you think about that? Like everybody just on the street being like, I'm going to get a GLP-1, I'm going to get this one. What do you think about that?
I don't think that GLP-1s are for everyone.
Okay.
This is still a medication. It's a drug. And it does come with other side effects that we're still discovering. So it's not a one-size-fits-all type of thing. When it comes to obesity overall or diabetes, let's start with diabetes.
Okay.
Diabetes is due to lifestyle.
We hope you're enjoying this Well Chat. Just popping in to remind you that we are a nonprofit dedicated to improving the lives of women globally through wellness education. To support this podcast, visit freedomatthemat.com and consider purchasing a Freedom Art Mat or journal to keep these conversations going.
Too many calories, eating the wrong things for a long time, and it has a genetic component to it. This is something to where if you exercise and you change your diet, you can have diet-controlled diabetes without any medications at all. So you can do it the natural, clean way. It's difficult, and it takes a lot of willpower, but it can be done, and I've had patients that have successfully done that. Okay. So when it comes to diabetes, these medications were studied for it because the cause of type 2 diabetes is eating too much and the wrong things.
Okay.
So that medication, the obesity, you cannot really separate that from type 2 diabetes.
Okay.
And you can get type 2 diabetes even without being obese.
Got it. So let's talk about the different types. There's so many different GLP-1s out there. We've heard about Wegovy. We've heard about a few of them. But can you walk us through the different brand names, the different types, and the different forms?
Absolutely. So when it comes to GLP-1 medications, this is a category of medications.
Okay.
So they've been around for over 20 years. Laglutatide was one of the first GLP-1 medications used to treat type 2 diabetes. But when Ozempic hit the market, it was different. It was more potent. It was a different amino acid peptide, and it actually really worked. So when we saw that this medication actually worked to help lower their A1C, or their baseline average blood glucose, without dropping their sugar, we said, oh man, this drug can actually cause them to lose weight, which when you get a gastric sleeve and people have type 2 diabetes, they end up coming off all of their medications once they lose the weight. So with this medication, once they lost the weight and it did not drop their blood sugar, we looked at it as, hey, we can use this just for medical weight loss and prevent people from getting diabetes. Or if you have pre-diabetes or diabetes, this is the safer option.
Got it. All right. So now what about the forms? Oral, injections, or different types, I understand.
Absolutely. So let's start off with naming. So Ozempic is semaglutide. So Ozempic was FDA approved to treat type 2 diabetes. A good side effect is that you lost weight and everyone was happy. When we found out that it works for medical weight loss, you have to have a different brand name for this drug. So it's still semaglutide, but we call it Wegovy. And Wegovy, it's a different name because the maximum dose on Wegovy is 2.4 milligrams every week. For Ozempic for diabetes, the maximum dose is 2 milligrams. So then we got another one. We got tirzepatide. Tirzepatide is the generic name, and then we have Mounjaro, which is for type 2 diabetes, and then Zepbound is FDA approved for medical weight loss.
Okay. All right. So let's say it's me or anybody who we don't have diabetes, we're not sick, we're not necessarily obese, we just want to lose about 15, 20 pounds. Would you recommend something as a doctor?
It depends. I always start off with labs, and I
Okay.
want to change the focus. I always ask everyone, what motivates you to want to lose the weight?
Right.
And then we figure out that, and then we figure out, hey, is it due to excess calories? Are we eating because we're bored? Different things like that. And then the overall message that I tell every patient is, we want to work on how you feel on the inside. So the goal is to be as healthy on the inside, get our metrics together, and then the outside will follow. And so that's the overall messaging. Focusing just on the weight is not the only metric that we're looking at. We want your body to function appropriately, because having excess calories, more weight on the joints.
Right.
So it's a whole bunch of other things that come with carrying excess fat cells, because fat cells are not just storage places for energy.
Right.
Fat cells are actually endocrine organs. They secrete hormones. They actually secrete leptin, which makes you want to eat more. And it also increases your risk for other cardiovascular disease and everything like that, because it's all carrying excess fat cells is almost like you're in a state of chronic inflammation. So we want to focus on more of the medical aspect of losing the weight instead of just the physical, because the physical follows along with your health and how you treat your body overall.
There's emerging research about benefits beyond weight and blood sugar, like effects on heart disease, brain health, and even addiction. Can you share what you all know so far and what is still uncertain?
Absolutely. So overall, with GLP-1 medications, we're noticing that it decreases fat not just under your skin or in your abdomen aesthetically. Fat actually surrounds around your liver. It surrounds in it actually deposits in your vessels. Fatty deposits can even be in your brain. So they surround all of these vital organs. They can cause long-term effects of that. So these GLP-1 medications are actually causing fat to be gone away from parts of your liver that can lead to liver disease or increase your risk for liver cancer. So it's more than just, hey, I want to look good. It's actually reversing some of the damage from being obese. For example, with non-alcoholic fatty liver disease, it's when people basically get cirrhosis for having too much fat that surrounds the liver. Before GLP-1s, there was not much we can do. We can do surgical procedures, and our number one recommendation is, hey, lose weight. That's easy to do, right?
Right.
But with these medications, what we found is they lost weight, but they also decreased the amount of fat that was surrounding their liver and actually reversed some of the damage to the liver from obesity. So that is great emerging research. And also when it comes to addiction, which is a great point.
Right.
What I found with my patients personally is that the food apathy isn't just food apathy. It's for most things, even alcohol. A lot of my patients reported that they didn't even crave drinking alcohol. I've had patients that have had problems with addiction for alcohol and struggled when they had to go to executive meetings and alcohol was there, because it kind of feels weird when you're in a setting and it's like, oh, I don't drink. But this made it to where that person did not have any cravings for the alcohol. So with that emerging research, and it's not FDA approved for it, but sometimes these side effects of these medications can be positive, not always negative.
Okay, well, let's talk about the negative ones, though, because you need to get that. So what are the negative? I mean, I know some of these drugs are new, and so there isn't enough research out because they haven't been out for long. But for the drugs that have been around for a while, what are some of the negative side effects relative to long-term use or even short-term use?
So the negative side effects are going to be around nausea, vomiting, and gastroparesis.
Okay.
Gastroparesis is basically when the nerves of the stomach don't really work like they should, so the stomach, the food contents in the stomach don't move forward, and it can make you feel nauseous. It could cause severe vomiting. It can also lead to pancreatitis, which is when the pancreas, which produces enzymes to digest your food, auto-digest itself, which is life-threatening. Also, it can cause problems with your gallbladder, everything that deals with your digestive system. But here's the deal.
Please.
If you already have type 2 diabetes, or you have a condition that has already caused gastroparesis or slowed gastric emptying, you should probably talk to your doctor, and it would not be the medication that I recommend, because the way the GLP-1s work is delaying gastric emptying, so slowing your stomach emptying forward. So if you already have that problem at baseline, this drug is not going to help you lose weight. It's going to land you in the hospital. So that's why it's very important to see a doctor and disclose all of your health information. So if you have diabetes, or you've been noticing that, hey, after I eat this meal, I have to vomit, or my stomach feels really upset, you need to see your doctor, see a gastroenterologist, and diagnose this. Don't just get on a medication or bribe your doctor to put you on a medication without doing the thorough workup.
So let's talk about that, right? So word on the street is that there's a black market for these drugs and that you don't have to see your doctor. And you've been saying over and over, see your doctor, see your doctor. I've been trying to get you right now to prescribe me something without seeing you. But you're like, no, you got to see your doctor. Let me see your doctor. So walk us through that. What's happening in the world with this black market on the GLPs?
What's happening is that people are bypassing seeing a doctor, and they're treating this medication as if it's a cosmetic when it's not. Even over-the-counter drugs are still drugs. The number one most overdosed medication on the market is over-the-counter. You want to take a guess at what it is?
Tylenol?
It is Tylenol. It is Tylenol. Just because a drug is over the counter doesn't mean it's safe. And if the drug has to be prescribed by a clinician, it is because it is not safe for customers to just pick it up and use it.
Got it.
So with the black market on these drugs, it's getting really scary, because people are just ordering a medication, didn't see a doctor, and it's arriving in a package by mail. You have to see a physician. You have to. There's labs that go into it. There's a physical exam that goes into actually making sure that you're healthy enough to take these medications. And there's been several investigational studies that have shown that sometimes these medications are coming from out of the country, and they may not even be the medication that's prescribed. All of these medications need to be refrigerated. So if it comes in a bag with the melted ice block, it probably does not work. So having a physician to see you and prescribe this medication, as a physician myself, I'm not going to prescribe a medication from a compounding pharmacy that is not certified, that I have not checked, and you have not shown me the purification or your third-party testing, because I have to protect my patients.
Right.
When you're ordering it offline without seeing a physician and they didn't ask for any labs, you should be worried. From all I know, you only get one body, right?
Right.
So see a doctor. We're not as scary as we're portrayed to be.
Right.
And I don't wear a white coat, so I'm cool, right?
Right.
I have a doctor. It's just me and you.
That's right. So, okay, so let's walk through this. So I come to you. I make an appointment with you.
Correct.
What happened? You give me an exam, and then you follow me through the entire journey. Walk me through what would happen if I were to come to you saying, hey, I just want to get on something. I heard about these products. I want to lose 15 pounds. Help me.
Because I'm a primary care physician at heart, I see the person as the whole person.
Okay.
You cannot change one thing without changing another, like the butterfly effect, right?
Okay.
So I understand your concerns. I always want you to get what you want. But as a clinician, I'm here to go through your family history and make sure you don't have a family history of medullary thyroid cancer, which is a contraindication for even being on that drug. I want to talk about your labs. When was the last time we had labs? Given your age, have you had a mammogram? Have you had all of these things? I don't want to start you on just something for weight loss and you may have a breast mass or something else that I'm missing that can take your life or cause morbidity or something like that. So we're going to go through everything. We're going to go over your concerns. And after I do all of that screening, then I want to know about your relationship with food, because I need to diagnose where the excess 15 pounds came from. Is it a problem of eating, like you just need to snack? Is it binge eating disorder? Do you eat a whole bunch of food and then regurgitate it? I need to figure out what is the cause. Now, if it's eating the wrong things, then let's go through nutrition labels. What should you be eating? When you go pick up a bag of chips, right? What is it? What is the serving size? For Cheetos, it's 8 Cheetos. Who eats 8 Cheetos?
Right.
I can't eat 8 Cheetos in a little bag. The serving size for a little bite-sized bag is a half a bag. So that's the basic of my education. I have to start there, because I put you on a medication that causes you not to be hungry or not even think about food, and I didn't educate you on what to eat. We're going to have a problem. Your hair is going to fall out. Your skin is going to look different. You'll be skinny, but you're not going to look the way that you want to look.
And so, in general, are there groups of people who, and if the answer is no, I understand that just should not be on these drugs? You mentioned a thyroid issue.
Yes.
But in general, are there people just, if they have this situation, they just should not be on them?
If you have type 2 diabetes and a diagnosis of gastroparesis, you should not. This is not the medication for you.
Okay.
It's not. It can cause other problems with gastroparesis, like pancreatitis that I discussed earlier. If you've had an isolated incident of pancreatitis, you should probably discuss it with your doctor and be very, very cautious, because if you had pancreatitis before, it can come back again. If you have gallstones, you should probably discuss it with your doctor. It's not an ultimate contraindication, but everyone is individualized. But these are 3 of the top things that I can think of to where I would say, hey, definitely never do black market things. But you need to talk to your doctor, and you need to bring these things up, because it's very important. It can land you in the ICU. And that wasn't our goal. We just wanted to be summertime fine, right?
That's it. That's all. That's all we're looking for.
But we want to be lifetime fine.
That's right. Lifetime fine. So there, in my research before we got here today, I found a study that said that there's some worry about cancer risk, especially thyroid or pancreatic cancer. Do you have any insight around that relative
Absolutely.
to GLP-1s?
Yes. So in the clinical trials, what they did find is they studied mice. We start off with that first, because a lot of their genes are mapped to ours. Okay. What they found is that it increased their risk of thyroid cancer in the mice. That doesn't necessarily mean that it'll do the same thing in humans, but since we don't have enough research, it's a strong say, hey, maybe not indicated for that person. Now, it's very, very interesting to note, mice and rats have more thyroid cells there. It's not exactly like our thyroid, so for them to have that greater incidence kind of makes sense, but we have not seen that in humans at all.
Okay.
Ozempic was FDA approved in 2017, but these medications, liraglutide is like 20 years old. So we have data on what it does, but we don't have any definitive data linking GLP-1 use and cancer. But it is something to be cautious of if you do have that family history.
Dr. Courtney, and I'm asking a question, we can always cut this out if it's not something you want to respond to here, but after the Percocet and the whole Purdue disaster, do we really trust FDA? Like, should I, as a consumer, as a discerning consumer, when I hear the word FDA approved, am I supposed to have confidence in that?
So this is where seeing an actual physician and getting individualized care is so important.
Okay.
The FDA's whole purpose is to make sure that this drug is doing what the clinical research has shown that it does.
Okay.
Number 2, it is to make sure that the drug is safe.
Okay.
Safe within reason.
Okay.
So if I'm prescribing this for type 2 diabetes, is this going to lead to cancer later? And then they have to prove that it works over and over. And then they actually certify that this drug, they give it a number, and all pharmacies can dispense it, right?
Okay.
So the FDA and the screening process is legitimate. That's what I refer to. Anytime I'm looking at a new drug, I want to see the clinical trial data. I want to see what the makeup of the population of the research participants were.
Right.
Did they have diversity in there? Were African Americans involved in the study? Native Americans? Because our genetics vary based upon gender, nationality, things like that. So it is. The FDA process is important.
Yes.
But you should trust what your doctor says.
Okay.
and looking at you as the person, your labs, your family history, and their medical knowledge, and being able to actually read the clinical trials and see what it says. Everyone wants to go home and do their own research, right? But go read the clinical trials data for Ozempic and tell me what it says, right? I'm not saying everybody has their specialty in what they specialize in, but clinical trials are written with statistics and indications and data that clinicians that have been trained in this understand. Okay. So FDA approval process, yes, we do need it. We do. But rely on your doctor and an expert to make the right decision in helping you choose the medication that's right for you.
Thank you for answering. I know that was kind of tricky, you being a doctor. I was like, I just need to know. I now no longer really have a level of confidence after the Purdue disaster. I'm like, well, if they can be bribed, I'm not really sure, what I'm consuming anymore and if it's real for me or not.
Well, it's in the industry, and that's why you have to have experts to go and look at these studies and say, hey, some drugs have so many side effects, I would never prescribe it.
Right.
But it's FDA approved.
Right.
Just because the medication is FDA approved does not mean that it's safe for everybody. These drugs require a prescription because they are dangerous.
Yes.
And
they're drugs.
They are drugs.
They're drugs.
These are prescription drugs. So trust your physician. Pick a physician you trust.
Okay. So now you and I were speaking before and you said, okay, these drugs are not meant to be used long term. Right? It's really more of a short term. Can you walk us through the long-term side effects if you should stay on any of these for a long time versus short time? Because I'm going to have a conversation with you. I'd like to see if I can drop these 15 pounds using one of these. I'm a little nervous about it, but I'm open to it. But I know I'm not going to be on these forever. But I'd like to understand the difference between short-term side effects and long-term side effects.
So when it comes to side effects, short term, anytime you're starting a GLP-1 medication, you're giving your body a little bit more of a hormone it's not used to. Okay. So with Ozempic, a lot of the earlier signs, nausea in the very beginning, maybe some GI side effects, but it should be minimal and it should go away. Okay. But I always tell my patients this, understanding the mechanism of action, how this drug works. Before I put you on this drug, we're going to have a talk about this nutrition. If I put you on Ozempic and you go and have a Mexican taco, chorizo, let's just do chorizo, right? You will be upset. You will be miserable. Okay, it delays gastric emptying. Your stomach will be upset. That's a lot of, fats. It's a lot of oils. It is not compatible with that medication. So your mind has to be ready to start on this medication. If you're eating the wrong things, it's going to make you very, very sick. So I always preface that with any patient. Okay. So when it comes to long-term or short-term, my goal is always going to be discuss with you what your goals are. And my goal is to get you off any medication if you don't need it long term. Now, when it comes to people that struggle with food noise, long term, we're learning in the research, it works very well for them. Okay. It cuts down the food noise. We don't want to lose all of the pounds and do all of this work only for the case to be back where we started. Right. So some people are on it long term, and it's microdosed. It can be not every week, but maybe once a month. Every patient is different, and this is a new frontier, even in how we think about obesity when it comes to the medical community. Alcohol addiction wasn't a accepted diagnosis not too long ago, so we're changing the way in which we think about it. But my goal is always to not have you on any medications if I can help it. But if we need it, we need it.
Okay. And so let's shift gears and talk about physical activity relative to these drugs, right? Mm-hmm. So I understand people think, okay, I can just get on a GLP-1, I'm going to lose the weight, and that's all I have to do. Do people who use these drugs still need to work out? They still need to drink their water? Talk to us about that.
It is so imperative for people that are on these medications to eat a well-balanced diet and to exercise.
Why?
Because you need to build muscle. As we age, it's very, very hard for us to maintain muscle. The more muscle you have on, the healthier you are cardiovascularly and cognitively. When you are basically starving yourself, you're eating what you want to eat, but less of it, and you're not exercising at all. You're losing the subcutaneous fat, but your body is like, hey, I'm starving, so it's going to break down more muscle, break down more muscle, break down more muscle. If you get the flu during flu season, you'll have a much harder go at fighting or getting over infections because you don't have the muscle mass or the right nutritional status for your body to be able to defend itself. This is so much deeper than just fat cells. This is about your overall body as a overall function. So we're not just fixing one metric. We have to fix everything. And it's a whole lifestyle change. I do not recommend anyone to get on these medications if you're not ready to make the lifestyle change, because you could be doing more harm than good to your body.
So if I'm on the GLP-1s, I can still work out. I still won't like cause me to have any. I think my concern is like when you take drugs, sometimes there's a side effect in which you're lethargic. Will you become lethargic with them, or can you still go and work out every day and go running and all that?
Absolutely. GLP-1s are basically just up promoting the GLP-1 signals that your body already makes. It does not do things like steroids, like go in and, cause you to feel like, Popeye or anything like that. All it's doing is basically allowing your body to modulate its energy input and output. And it gets your brain on board to say, hey, when I'm hungry, maybe I should go grab a salad. And when you start to eat those salads and those sorts of things, pay attention to the way that you feel. Okay. So people that have been on GLP-1s before, they'll know what I'm talking about. Hey, the food apathy is real, but if you decide to make the healthier choices, you'll feel that satisfaction that you felt with the cupcake eventually. It's getting your mind into the thing of, hey, I need to feed my body the right fuel, right? We wouldn't go and go get a Lamborghini and then go buy gas for the Lamborghini,
87.
From the guy next door. We wouldn't do that.
Right.
So we don't need to do that to our bodies. We need to put in the right things so where it functions optimally.
Okay, so now as we close this out, can you give some practical guidance and advice for our listeners, for anybody who's like, you know what, now I'm feeling more comfortable. I'm a naturalista like Olivia, and, I've been concerned if I've been reticent, but I'm going to reach out to my doctor. What are 3 smart questions that a potential patient might take to their doctor about getting on GLP-1 medications?
So instead of the questions, I have homework first.
All right.
Homework first is, why do I want to lose weight? Start paying attention to your eating habits. Before you make that appointment with your doctor, or make the appointment a couple of weeks out, I want you to keep a food diary. Okay. I want you to note when you're eating and what you're eating, because the number one response that I get all the time is, hey, what did you eat? I always ask, what did you eat yesterday? Just to go down the nutrition so we can add up the carbs, the calories, and then we add in the carbs and calories from what you drink as well. If we're drinking a large lemonade from Chick-fil-A, that's 92 grams of carbs. That's a meal,
and
right?
How much sugar?
And how much sugar. So number one, their doctor is there to try to diagnose what is causing the obesity, right? Because in order to prescribe that medication, it has to be tied to a diagnosis code for your insurance to even think about paying for it.
Got it.
So figure out if you're binge eating, if you're doing these things, it's very important that you share these tips with your doctor and come ready with that information so that the doctor can do theirs. And the questions you should ask your doctor, number one is, hey, would you recommend a GLP-1 for me to lose weight loss? Don't go in there just saying, I want to be on Mounjaro, works for my sister. It doesn't work like that. Just because it works for your sister does not mean that it's the right medication for you. Okay. When you have to let the clinician do what they need to do, and that means that we need some data, we need some information. So change the mindset about how you think about GLP-1s. The goal is not just weight loss. We want to look good on the outside and on the inside, most importantly.
So, Dr. Courtney, of course, we're talking about eating well, and of course I can't help but notice this cookbook. And I noticed the one particular recipe about Cajun broccoli. Can you walk us through what's in this cookbook?
What's in this cookbook is the first chapter is basically a guide. What are good fats, bad fats? How does your metabolism work? Because before we even get started in cooking, let's identify that. The rest of the book is about small recipes, right? So recipes that are easy for you to make, that are low carb, that are nutritious. And each one of the recipes comes with a nutrition label, so you know the serving size and how many servings it makes, so you can stay within your carbs and actually get the nutrients that you need. I'm a mother of twins. They're 8 and they like to eat me out of house and home. This is for everyone. These recipes don't take long. It's mostly things that you probably already have in your pantry.
Okay. So let's talk about this though. Can I still eat out, or do I need to use like your recipes? Do I need to like cook, or can I still go to McDonald's and Sonic to lose weight?
No, that's not going to be the best way that you lose weight. It's going to start with cooking.
I have to cook.
You have to cook.
Okay.
There are slow cook meals, slow cooker meals to where you just put it in the crock pot and it's done when you wake up or it's done when you get home. You have to cook. Knowing what you put in your food, you're able to control the amount of sodium in there. You're able to put the amount of protein that you need in there. Trying to eat out and lose weight is going to be very, very difficult because those meals are most of the time pre-cooked. So they have preservatives, higher sodium, things like that. If you actually want to feed your body what it needs, you need those vegetables lightly steamed. Your body processes it much better.
Really? So steamed?
Steamed, or you can stir fry it. However you cook it, just don't cook it down to mush.
Okay, very well. Thank you so very much. Where do we get this cookbook? If I want to purchase one, or our Freedom Ettes want to purchase one, where do we get it?
So it's on Amazon. It ships everywhere. So you can order it on Amazon, or you can come into the clinic and pick up a copy.
3001 Napoleon Avenue in New Orleans.
Yes.
Beautiful. Dr. Courtney, thank you so much for your time today. And for everybody who's listening today, I thought I was going to walk out of here with a script or something. It seems like I have to do some more homework. I'll start with my food diary. And I invite you to do the same as well. These GLP-1s, yes, there's a lot of noise around them. But as Dr. Courtney is sharing with us, it's really around us really prioritizing our health, our wellness, continuing to be fit, working out, being active, drinking our water, and eating nutritiously. However, should you decide that, I'm obese and I actually need to get this taken care of, or I have type 2 diabetes, then fine. But make sure that you do it the healthy way. Don't go on the street, no black market work, and make sure that you honor your health every single day. May God continue to bless each and every one of you. Ashe.
Journey with each day of the rising sun. I may seem broken, but I'm on my way to